Bismillahirrahmanirrahim. Allahu Akbar. So, take one puff. Good. Take another puff. Better?
Thank you.
Good.
£7.40, please.
You can pay us next time, okay?
Should I not make a living?
Mashagana.
I may be slow, but my ears work just fine.
What?
I hear things.
What do you hear?
I hear there's a lot of nice single women in Florida.
So you've got 2 years to get rid of me, hmm?
1 year, 11 months and 4 days. I'd rather keep what I have. So take your pills and stop getting worked up.
Okay.
What do you want? Is it about Rani?
You don't ever say her name. You will never contact her again. And if she tries to contact you, you will ignore it. Understood? Understood?
Yeah. Can I go, please?
Of course.
You're wrong, Jay. So the red cabbage and chili flakes is all down in...
Could we stir fry? Well, I'm only saying.
It's not food. Right, he's losing colour.
Anaphylactic shock. Let's get him to resus.
You promised.
Please change.
But you said.
Get away from her. You deal with me.
Come on, old man.
No more.
Yes, more.
No, we've done everything for you. It's enough.
I decide when it's enough.
No. Give him nothing, Rachel.
Give me what I want. Come on, darling, give it to me and we're gone, all right? But I won't need to come back here again.
That's what you said last.
You should have come before we got in the car. I gave her the keys. Go on then.
What's going on back there?
I'm coming.
Great. Just great.
Can you stand? No,
This couldn't have happened tomorrow or 3 days ago, or basically any day that avoids me waking up to an unconscious girl in my houseboat. This isn't happening.
Okay, Sat's at 91%, BP's still falling.
Okay, talk to me.
Right, we've given him 0.5 milligrams of 1 in 1,000 adrenaline IM, 200 milligrams hydrocort IV, 10 milligrams chlorphenamine.
Right, well, let's bag him in intubate, please.
Right, can I get a size 8 tube and a bougie, please? Mads.
Come on. Get another one. Vitals?
Pulse tachy at 120, Sat's now 92.
I'm telling you, darling, don't argue with me. That bruise wasn't there yesterday. There's no obvious cause. I haven't even moved her. What do you think, nurse? Any ideas? No, I didn't think so. Right, come on, time to go. It's okay, I'm a doctor.
Just leave it, I'm fine.
No, you're not.
I am.
You're not.
Lenny, just leave me
It's
alone.
starting to affect your work.
I apologise to Mr. Jordan.
What about me?
I don't need to explain myself to you.
Well, no, as a doctor, no, but I kind of thought perhaps as a friend.
As a friend, you know to leave me alone.
Yeah, you've been saying that for weeks as well.
Exactly.
All right, so I'll just leave you alone and let you give up your life to some guy who 2 months ago could not have identified you out of a lineup.
It's not about that.
It is.
It isn't.
It is.
It isn't.
Yes, it is.
Lenny, sod off. Just go, please.
I'm sorry.
Please.
Yeah.
You might have mentioned you're only a child before I let you collapse in my house. Come on! Patient on board! Patient on board!
Thanks for me, darling. Thank you very much.
All right, take your time. Got it.
Okay?
Oh, you're okay, got it?
Yeah.
Jeff? Yeah? Can you and Gary take Mr. Lanning, please?
Yeah, sure. Yeah. You all right?
Yeah, I'm fine. If you just want to follow Jeff, he'll take you to where they're going to treat your husband, all right?
Right.
Good luck! Where's she back?
She's a patient. I can take it from here.
Come here. Let me help you, okay? Got her?
Weapon still in situ. On arrival, GCS was 14, it's now 12. He's had fluid, oxygen, 10 of morphine.
Tess?
Middle there, please. Thank you. Thanks. Do we know what happened?
He was pushed. I didn't see.
I'm here, darling.
Sorry, mate. Nearly there.
Take care of him.
All right, when you're ready, please. We got some? Yeah. 3. 1, 2. And across gently. 1, 2, 3. Okay, good.
Great, thank you, Jeff. Have a safe day.
Right, can I get 1 unit
Pulse
O negative blood, please?
130
Cross-match
and
2
rest
units.
Get that one nasty, yeah. Okay, let's get a trauma series, please. Folks, can we get the ultrasound in here, Linda? Let's get his history. Mr. Lan, I'm Mr. Jordan. I'm the clinical lead here. I'm just going to have a feel around. Tell me if it hurts anywhere.
Rebecca Matlock, get a patient number from yesterday's records.
I still think we should have taken her to resource. They've got the equipment.
She's my patient.
Okay, let's get her over then on 3. 1, 2, 3. I don't understand.
She's my responsibility.
Well, this place doesn't work like that. Dylan, you're putting her at risk.
Your patient, the one that you brought in, he's tacky and in atrial fibrillation.
You saw the monitor.
Even with the anticoag, I give him 50-50 chance at best.
And that's just guesswork.
The injury, together with the anticoagulation, is consistent with his condition. This is not guesswork. Abdominal injury is a special interest of mine. If I can't fix my patient, rest assured, I will be the first to say I can't fix my patient.
I thought you'd already fixed this patient.
Long story.
Well, I look forward to hearing it. Cheers, Dixie.
She followed me home. It was late.
Did you let her in?
What was I supposed to do?
You're an idiot.
Thank you so much.
Matt.
Yeah. Thank you.
96 over 64 is tachy at 120.
Right, thank you.
His INR's through the roof.
Okay, we need to reverse the anticoagulation. Right, listen up. Vitamin K and PCC, please. Let's repeat the INR every 30 minutes. We need to get this down, otherwise he'll bleed out. Okay?
Yeah.
Thank you.
They will want to talk to you.
I've got nothing to say. It's a little late for them to be offering their assistance, don't you think? Police protection. We put our faith in a different covenant. He guides us.
Have you got it? No more of that hospital crap. You do it.
His fractures are stable, even yesterday's.
There's a hell of a lot of them.
They're not the cause.
Well, something must have been missed yesterday.
No.
She's got Colin's sign, Dylan.
Well, she wouldn't have been able to leave the room, let alone walk out of the hospital.
And all the way to your little boat. You know what? I'll guess this is traumatic pancreatitis.
I wouldn't have missed that.
Dylan.
It's not pancreatitis.
Not something you'd have been looking for, Dylan.
It's not something I would have missed. It's something I would have found.
She's developing grey turners.
Zoe, of course.
What? What?
His blood is very thin. It's not clotting as it should. Does his GP prescribe any anticoagulation tablets at all?
He doses himself.
90/65, down by 100.
He's obviously developed a temporary tamponade with partial clotting. Well, that's safe for now, but we do need to stabilise your coagulation. We'll get you up to theatre. The surgeons are already aware. It's okay. It's fine. Everything will be all right.
You'll be asleep. It's much more difficult for the people who are awake.
Tell them.
Okay.
What's happening?
Okay, lie still.
Tell me!
Let's get him down.
No.
4 milligrams of the razepam now, please, quickly.
Mrs. Lamb? How's your husband?
See for yourself.
The emergency call, it was logged as a stabbing. And this has been corroborated by the 2 paramedics who attended.
My husband is very ill. This is not the time.
I've been through your case notes. It says on the 7th of January last year, you reported an aggravated assault.
Can I get some air?
And then, after an arrest was made, you withdrew that complaint.
That's history.
A year and a half. That's a long time.
Thank you. A new face. They're all the same.
What did he mean, a year and a half?
Today, it's not the first time. He's come to us many times. In our shop, sometimes our home.
This has been going on for a year and a half. What about your protection?
He'll get through this. We're retiring next year. It's all planned. It comes down to faith.
You don't think anyone might miss that?
Celia, you should have an ultrasound.
Her systolic's 106 and dropping. You need to send an amylase, Dylan.
No, AAA. She has an abdominal aortic aneurysm. Secondary to malnutrition, more specifically, a vitamin deficiency.
What's her surname?
Matlock. It's only bled into the aortic wall for the time being. We should manage it by keeping her blood pressure on the low side.
I think she...
There's no need to open her up just yet. Gel, please. Cute. Okay, this might feel a little bit cold. Okay, fine.
Okay.
How is he?
We think that reversing the anticoagulation has caused a clot to form in his brain.
You think he's had another stroke? Can you still operate on him?
With the wound stable, the priority is a head scan. As soon as that's done, we'll get him up to surgery. We fast-speak the stroke team. We're all on standby, so as soon as we can, we'll get him up. Okay? Thank you, Tess.
Would you like to see him?
All right, mind your back, love, please. Mind your backs.
Excuse me. You.
Okay, mate, can you hear me?
There seems to be some free fluid around the peritoneal space.
It's unclear. It could be an intramural bleed.
We need to visualise the aorta. Look, her bruising's getting worse.
We need to get a full history.
No, we need to get her to resus.
She's holding the key to this. I'm sure of it.
Hi.
You are a liar.
Dylan.
What happened to you yesterday? If you want me to save your life, you're going to have to tell me. Or don't tell me, and you'll die.
I told you I got mugged.
I'd say you've got until about 2 o'clock.
That's enough, Dr. Keogh.
Punch me.
No.
Is this your bedside manner?
Tell me the words I want to hear.
I told you the truth.
No, wrong. Try again.
Dylan.
There is something you're not telling me. Where do all these old injuries come from?
I really don't know what you're on about.
You need to start trusting me. If you don't tell me what I need to know, I can't save you.
Dylan, listen to me. What are you testing for now?
IPAs, trypsin, and amylase.
Oh, so you are testing for pancreatitis?
No, I'm testing against pancreatitis.
What she needs is an abdominal CT and to get to resus now.
It doesn't matter because it isn't pancreatitis.
Do you know that?
Why did you steal my wallet? That's £700 in there.
I wasn't going to take all of it. I just needed 340 quid.
Why?
Found a flat. I could get away from him once and for all.
Pressure's dropping.
Right, I can handle this. We need her notes.
No, stop, Dylan. We can't keep her here
There's
anymore.
something that we're missing. I know, it's something important. The key to this is in her history.
Stop this!
We need to get the notes from where she was last treated. Yeah, you'll need that.
Is this why you didn't want to sign her in? She's 15. No one will blame you, Dylan. Up to right now, no one will blame you. But if you keep her here any longer, they will.
Just get me her old notes, please.
Shouldn't be long now.
We do need to talk, Mrs. Lamb.
Not here.
Whatever he said to you,
Who?
you know now that it's not true. All the promises, all the reassurances. Do you know what I've learned? I've learned that at some point when things don't quite go to plan, they bite the hand that feeds them. Every time.
Lenny, Sister Bateman, I need your help.
Right, go with the lorazepam.
That's dropping 88.
Right, we need to get the stroke team here now. Is that in yet? Okay, let's get his head scanned and get him up to theatre.
Well, I know they're backed up.
Tough. Good to go. Go. Okay.
Hi, Rani, it's Mads.
Right, St. Bart's have faxed over her casualty now.
I'm missing something terribly obvious. Where's the rest of them?
There isn't any more.
But it can't be. She's got dozens of old injuries. It says she's only been in 3 times.
Dylan.
I have to call the hospital. There must be another hospital.
Dylan.
No, I can fix this.
No, you can't. She's in hypervolemic shock and she needs to go to resus.
I just need to find the
No!
source.
You've tried.
Damn it.
Tarek.
Damn it!
Resus. Look, I'll take her.
No. It's very kind of you. I can do this.
Dylan.
You need to hang on to those. The answer is in the history. I remain sure of it.
She's not on the computer. She's not in the department.
Scared? I can't fix this patient.
Well, don't just stand there. Let's get her through. Come on. Who is she? Where's she come from?
She came in yesterday. She discharged herself. She spent the night at mine. She's 15, by the way. And I missed something.
15?
All right, I missed a couple of things.
On my count, please. 1, 2, 3.
OK, what have you established?
She has a bleed of unconfirmed source. Although initially stable, her blood pressure is now falling. Ultrasound was inconclusive. She has Gray Turners as well as Cullen's sign.
Dr. Hannah has been urging me to bring her in.
I prefer to solve the situation on my own. To be fair, I am normally spectacularly good at it. On this occasion, it seems that was not the case.
Your actions reflect on this department, Dr. Keogh, on all of us. We're a team. You should act responsibly as a team.
Hang on, Nick.
Yes, I will accept your resignation with immediate effect. Now get out, Zoe.
Lenny?
Listen, I was thinking maybe I would like to start this
There's
day
something I
again.
would like to tell you.
Yeah, what's that?
That night when we all went out for that drink and I got into the minicab.
Mm-hmm.
On my way home, I was attacked.
BP 82/47, she's tachycardic.
OK, we're up next.
No, forget the CT, Zoe. We haven't got time. She's deteriorating badly. Right, she needs a laparotomy. OK, call Keller. Get a general surgeon on standby. This is a pancreatic bleed until someone tells me otherwise.
How is he doing?
He's being scanned. It doesn't look good.
I'm very sorry.
CS was 8 on arrival, BP 120 over 6 to 7.
Pupils will pinpoint. Evidence of IV drug use, administered oxygen, 0.8 milligrams of naloxone repeated twice. GCS rose briefly to 12, then back down to 8. Breathing's been shallow and irregular throughout.
Even with all the naloxone?
Yep, right, so, okay, let's get him over, please, ladies and gents.
Yeah.
On 3, 1, 2, 3, get him over, 1, 2, 3.
That's at 86%.
Oh, hello. How's the old man doing? Get that a lot with women?
Not from this one, Jeffrey.
Suppose you've heard about Wonder Doc. Off again, apparently.
Why?
Oh, I don't know, some patient he tried to cure all by himself. Didn't quite work out. Good riddance, I say.
Jeff.
He deserves it, Dix. It's dangerous. Oh, come on, mate. After everything that's happened. Blimey, what are you thinking?
I'm thinking that our wanting him to suffer, it isn't going to bring Polly back. It ain't going to change anything.
Well, it clearly hasn't changed him, has it?
Maybe.
And what's that supposed to mean?
I'm just saying that none of us have exactly been offering him the warm hand of welcome back, that's all.
Well, he's really got to you, hasn't he?
You know what's not to like? He's intelligent, confident, good-looking. I think I quite fancy him, really. No, I'm joking. Obviously. Right, you go on. I'll see you in 5 minutes.
Yeah.
I just said what happened.
Should never have let me bring her in here, I did tell you.
You were trying to do the right thing by your patient.
You sure about that?
You know, Paul, it wasn't your fault, okay?
That's not what your colleague thinks. If I recall, he wanted to reposition my nose.
Well, Jeff was upset, we all were.
And she was killed by my patient.
And you weren't to know.
But I think that's the point. Don't you? I don't like them very much. Patients, I don't know. I don't care. I don't have feelings about them one way or the other.
You've quit, right? So what's all this then?
Blood results.
Don't get it.
His sats and respiratory rate keep falling.
Right, let's go again. Another 0.8 milligrams naloxone, please. Something isn't right.
You can't stop this here, you know, Rachel. You can end the suffering.
What do you want from me?
I want a name. Come on. We both know who did this to your husband.
Tell me, why do you care so much? We don't know each other. You talk of my pain. What do you know of my pain?
I've done this job a long time.
I'm sure.
I like putting bad people behind bars.
Excuse me, Mrs. Land, coming through. Linda, will you let the theatre know that Mr. Land's ready to go up?
The problem is, long after you've moved on to bigger and better things, we're left dealing with the consequences.
The effects of a stroke are unpredictable.
Could he recover in time?
Yes, I have seen some recovery with the right care and support.
At least there's that, huh?
The problem is when blood is prevented from getting to certain parts of the brain. When a cubicle comes free, we'll get you in there. The stroke team have reviewed your husband. They'll see him again when he's back down from theatre. They'll come and find you. Right, we'll leave you in peace.
Sure you okay?
You all right, mate? You're okay? Let's see. Okay, let's get you up a bit. My name's Dr. Lyons. You collapsed earlier and your breathing's still quite erratic. Can you tell me what you've taken?
Methadone.
Okay, anything else?
Are you sure?
Right, well, any underlying conditions we should be aware of? Right, well, mate, you're not very well at the moment. You're not breathing properly, and without the right treatment, you're heading for respiratory arrest. There's not much more we can do, do you understand? I have to just hope that whatever he's taking wears off. I'll be back in a second. Do a urine tox screen and repeat blood gas.
Okay.
I did this to you.
You don't understand.
Let me go. I do understand.
You don't understand.
You shouldn't have come to the shop.
No, it's my
You're a
girlfriend.
bad boy.
It's my girlfriend too.
Please, come on, you need to let her go.
Listen to me.
No,
It's my girlfriend as well.
Please, let go. Just calm down.
You okay?
You're not listening to me. Please. She's pregnant.
Just calm yourself down.
BP's still falling and she's peripherally shut down.
Right, that's it. We run out of time. We'll have to do the operation down here. Tess, you get a urinary catheter in, please, Zoe. Look, if a theatre becomes available before I make the incision, then we'll take her directly up, okay? Good. Let's get on with it.
I'll put a central line in.
I need an ambulance, please.
Did you remember?
Skim milk? Yes.
It'll save your life.
No, I don't think that's likely.
Colby Control 3004.
3004 receiving over.
We've got an anonymous call reporting an overdose on farm.
Well, it won't be the first time.
34 Mandela Heights, a young female, pregnant, over.
Take that for us, mate. Thank you.
Ah, Dr. Keel.
Neil.
No.
Good. Yes, what can I do for you?
Blood results.
Amylase, electrolytes all normal.
That's good, isn't it?
No. Of course. The gel. Of course. Thank you, Nigel.
No.
I know what's wrong with her.
Out, please. This patient is sterile.
No, listen to me. Her bloods.
We've seen her amylase. It doesn't mean anything.
Well, the bleeding must have come from somewhere.
We know where her bleed comes from, thank you.
No, I didn't just test her amylase. I tested her lipase and her trypsin. All perfectly normal. If you go by the modified Glasgow criteria, even by Ranson's criteria, she does not have pancreatitis. I told you the answer was right under my nose. The ultrasound gel. It's always cold. Patients always react in exactly the same way. Contraction of the small muscles.
And?
Hers didn't contract. I noticed at the time, I didn't think anything of it.
And your point being?
When I asked her about her historical injuries, she didn't know how she'd got them. There's a reason she's only been to hospital 3 times. She was telling the truth. She didn't know how she'd got them because she didn't know she had them in the first place. She has congenital analgesia. She hasn't felt pain since birth. We didn't think to look for a leg injury because she was walking just fine. I even sprang her hips. No response. I think she has a fractured acetabulum. This would have worn away at the common femoral artery. This could have caused a retroperitoneal bleed.
And she is bleeding briskly into the retroperitoneal space, so...
It's obviously incredibly unstable.
OK, thank you, Dr. Keogh. We'll take it from here. Test cancelled, the general surgeon. Doesn't change anything. No, it doesn't. Right, let's get an orthopaedic and vascular surgeon on standby, please.
Wake up, darling. Please.
Mrs. Lan?
He swore to us, no more visits. He should never have been there.
What happened?
Mendel had enough. No more, he said. I could have stopped him. Why? All you had to do was keep quiet.
Sometimes it's hard to keep quiet.
Nothing is harder than this.
Did you make the right choice? Should you have gone to the police?
This all started because Mendel went to the police. After our very first visit, they made an arrest, assured us we'd be protected, but he was out within a week, pending trial. They didn't care. He paid us another visit. He was angry, very. He pushed me. I fell. Whilst I was in the hospital, Mendel dropped the case. If we'd done what he wanted that first time, he would have gone away.
OK, let's get up there as quickly as we can, please. I'll get the lift, Zoe.
OK.
Where's Dylan?
Dr. Keogh has lost his job because you stayed with him last night, Becca. Will you tell me exactly what happened, please?
He took me in.
And?
Nothing. He stayed in his crappy car and insisted on it.
Mr. Jordan?
Yeah.
Matt? Yeah? This came for you.
Thank you.
You all right?
Yeah, I want to come with you, okay?
What?
To the police when you go.
I'm not going to the police.
Mads, the guy's got to be punished.
I don't want it to become a part of my life, and it will.
You have a responsibility.
Don't tell me about my responsibility.
The guy assaulted you.
And I want to be able to move on with my life.
So why come to me?
Because I wanted you to know. Please, Lenny, I need you to respect my wishes.
I don't like the idea of someone hurting you and getting away with it.
But that is my wish. I just want to forget about it. Please.
On arrival, mother's GCS was 8, pulse 56, BP 98 to 48,
Let's get 2 teams on this,
GCS was
please.
10. Gave her 1.2 milligrams in the naloxone. She responded briefly after 3 shots. GCS came up to 10 and it went back down to 10. Back down to 89%.
Keep the heart monitor over, please.
That's my girlfriend. Is she going to be all right?
That depends, young man.
And what about the baby?
You need to tell us what you've taken.
I can't. She can.
Do you know these people?
I thought it was for him.
If we're going to save them, we need to know what they've been given.
I introduced ozaptam into the methadone.
The effects would be masked. It would appear to be a methadone overdose, and the standard treatment
Wouldn't work.
No wonder that naloxone had no effect. Wayne, we need to amend their treatment regime, please. Keep a close eye on their GCS and respiratory efforts. Start them both on flumazenil straight away, please.
Will it affect the baby?
And everyone's chances will be a lot better. Now we know what we're treating. She's out of surgery. You very likely saved her life today, but you also put her life at risk. There you go. Don't do it again.
Shortest resignation in history.
Have I you to thank, Clam? I'd offer you out for a drink, but we both know it ended sex.
How about we just start off as friends, yeah?
With the possibility of sex later on.
Oh, of course. Oh, does that mean I get to go in this?
Well, I have to really like a woman.
Shame.
Awesome air conditioning system.
I can tell, clearly. One day.
Well, see you tomorrow then.
Can't wait.
Stop waggling.
Stop looking.
Rahim. Allahu Akbar.
Take one puff. Good. Take another puff. Better?
Thank you.
Good.
£7.40, please.
You can pay us next time, okay?
Should I not make a living?
The sugar now.
I may be slow, but my ears work just fine.
What?
I hear things.
What do you hear?
I hear there's a lot of nice single women in Florida.
So you've got 2 years to get rid of me, hmm?
1 year, 11 months, and 4 days. I'd rather keep what I have. So take your pills and stop getting worked up.
Okay.
What do you want? Is it about Rani?
You don't ever say her name. You will never contact her again. And if she tries to contact you, you will ignore it. Understood? Understood?
Yeah. Can I go, please?
Of course.
You're wrong, Jay.
So the red cabbage and chili flakes has got all down in...
Could we stir fry?
Well, and what is eating? It's not food.
Right, he's losing colour.
Anaphylactic shock. Let's get him to resus.
You promised.
Please change.
But you said.
Get away from her. You deal with me.
Come on, old man.
No more.
Yes, more.
No, we've done everything for you. It's enough.
I decide when it's enough.
No. Give him nothing, Rachel.
Give me what I want. Come on, darling, give it to me and we're gone, all right? But we need to come back here again.
That's what you said last.
You should have come before we got in the car. I gave her the keys. Go on then.
What's going on back there?
I'm coming. I'm coming.
Great.
Just great.
Can you stand?
No,
This couldn't have happened tomorrow, or 3 days ago, or basically any day that avoids me waking up to an unconscious girl in my houseboat. This isn't happening.
Okay, Sat's at 91%, BP's still falling.
Okay, talk to me.
Right, we've given him 0.5 milligrams of 1 in 1,000 adrenaline IM, 200 milligrams hydrocort IV, 10 milligrams chlorphenamine.
Right, well, let's bag him in intubate, please.
Right, can I get a size 8 tube and a bougie, please? Mads.
Come on. Get another one. Vitals?
Pulse tachy at 120, Sat's now 92.
I'm telling you, darling, don't argue with me. That bruise wasn't there yesterday. There's no obvious cause. I haven't even moved her. What do you think, nurse? Any ideas? No, I didn't think so. Right, come on, time to go. It's okay, I'm a doctor.
Just leave it, I'm fine.
No, you're not.
I am.
You're not.
Lenny, just leave me alone.
It's starting to affect your work.
I apologize to Mr. Jordan.
What about me?
I don't need to explain myself to you.
But not as a doctor, no, but I kind of thought perhaps as a friend.
As a friend, you know to leave me alone.
Yeah, you've been saying that for weeks as well.
Exactly.
All right, so I'll just leave you alone and let you give up your life to some guy who 2 months ago could not have identified you out of a lineup.
It's not about that.
It is.
It isn't.
It is.
It isn't.
Yes, it is.
Lenny, sod off. Just go, please.
I'm sorry.
Please.
Yeah.
You might have mentioned you're only a child before I let you collapse in my house.